I'm a medical doctor from Nigeria. I've worked with the primary healthcare board in my state for 2 years now. So I got a study leave to come study public health here in Aberdeen.
I did my undergraduate here. I did neuroscience and psychology, which was a very core science orientated, and I wanted to look at ways of how that could be applied within a healthcare setting.
In India, I completed my general nursing and midwifery, and then I completed my postgrad diploma in public health management.
I was a third-year medical student over here at the University of Aberdeen, and I decided to intercalate, and I wanted to get some experience in research, so I decided to do the Masters of Public Health. The first 2 semesters entail doing 4 taught modules, and the final semester involves doing a project.
The students have a chance to take 2 optional courses along with 2 core courses in both of the semester.
There's a huge variety of courses. So there are courses which pertain to health psychology, healthcare economics. There's also some courses from the management school and leadership, so there's quite a wide variety of things, so you can sort of tailor the course to your needs and your wants.
Some of them are delivered online as well for increased flexibility, so I did one of the online modules.
We have NHS doctors that take us on some modules. It's not only the theory, now we get to learn what happens practically out there in the field of public health.
It's really a good point combining a rural infirmary next to the university campus, because university has rich history in clinical research, so it is really accessible for all the clinicians and the team with the researchers.
I want to do research while I'm a clinician, and I feel like this course has taught me the skills that I would need to be able to do that. That includes actually designing medical and epidemiological studies, and learning statistical analysis, and learning how to write academic and scientific papers. There were students from a social science background, so psychologists and sociologists, and there are also students from a more basic science background, so neuroscience and cell biology and so on. And they all do bring in their various different, areas of expertise and perspectives and so on into the course. So I found that just talking to them and engaging with them also helped me learn quite a lot.
For the projects, the school makes a list of project topics available. But then if any student actually has a topic at the back of their mind, they could come up with that.
They ask supervisors to pitch projects, and some of those come from NHS Grampian, which means it's really nicely integrated. You still get an academic supervisor as well. It's really nice having the 2 different inputs and seeing how the work integrates into the wider NHS.
Instead of doing 4 modules in the second semester, you can do 2 modules and then an extended project in the final semester. And that's actually what I'm doing because I already knew my supervisor prior to that, and we had a large project in mind. Our project is about fatigue, and we were essentially performing a statistical analysis of data. For a project like mine, a lot of it actually depends on the skills that you've been taught in the modules within the course itself. So because it's very statistics-based, just having access to the relevant statistical software, to advice from statisticians, and also just the knowledge yourself in terms of how to do it was very important. The university enables you to download the relevant software onto your own computer, so you can work from home as well if you want to. Through my supervisor, he actually collaborates with academics that work in institutions around the United Kingdom. So if you're sort of research-minded and you want to go into a research career, you will find that if your supervisor is well connected, you will begin to sort of create a network of other researchers just through the work that you do over here.
I really like Aberdeen. It's a small enough town that you can, as a student, you don't need a car, you can get to everything you need to, and I can see the sea from my window. That's absolutely lovely.
I get to buy my African foods, so I don't think I miss home too much.
I do want to move towards more research, whether that's in the format of like a PhD or research within an organisation, looking at sort of service planning and service organisation and how that sort of fits into policy would be where I'm heading, or hopefully.
I hope to go back home, go back to my work with my government. Then I think my bigger plan would be probably to get into a big multinational organisation.
Once the master's is over, I'll be going back into 4th year of medical school, so I'll have to complete 4th year and 5th year, after which I'll be applying for the Medical Foundation program. And there's a certain subset of the program called the Academic Foundation program, which is for doctors who are research-minded, and I'll be applying for that.